Hi everybody, this is Dr. Eliana Aaron, Director of EMA-Care. I hope everyone is staying well and staying safe. I'm going to talk today about telemedicine because this is a very new trendy thing that some people heard about before the pandemic started, but now pretty much everyone has heard about telemedicine. And I'm going to talk about what it is, as well as different possibilities for using it, how it's being used in Israel, what are the resources available for Israel, for both people living in Israel and for students or tourists who are visiting Israel. So I'm going to go ahead and start with talking about what telemedicine is. Telemedicine is a way for people to have remote health services without being physically in the same room as your healthcare provider. This was initially designed back many years ago by countries like Canada and Norway that had very remote locations and had to provide healthcare to people who lived very far away from the normal civilization. And this would normally happen on a phone. You would speak to your doctor. Some of the problems that developed early is how do we get a prescription to people? So there were some creative solutions that happened, and in some cases, some of these issues couldn't fully resolve. It is estimated that, I would like to just say that Israel had a form of telemedicine even before them, which is the concept of the kibbutz nurse. The kibbutz nurse, and we have a wonderful kibbutz nurse on our staff, and a kibbutz nurse would be on a remote kibbutz in Israel. This predates the state, and she would be examining patients, and the doctor would come in every couple of weeks if needed, and she would consult with him on the phone on behalf of the patient who was right there in front of her. So that was a form of telemedicine back in the day. And that was quite remarkable considering the very poor resources that existed in Israel in those days. So telemedicine really started kicking up as applications and health applications started to become popular. And people started wanting to use their phone as a way to access services. So it started off in Israel with, of course, the Kupot Cholim having applications. So you could make requests through the application. You can write to your doctor. You can make appointments. You don't have to call people. And you can even request medications to be refilled without physically going to the doctor. That was pretty revolutionary for us, at least. And a lot of people utilized these services. The people who did not utilize these services are the elderly. Elderly people, and I'm going to say people over the age of 70, have a very low rate of using the internet or using their phones to access healthcare. They're just not used to it. It's not part of their culture, of how they were raised, and it's just not something that they're comfortable with necessarily. So it's down to about 25% of the population over the age of 70 actually uses the internet or their phone to access health services. So that's a limit right there, because 90% of the services that are needed in Israel are among the actually 11 to 12% elderly that we have here. And most of them can't comfortably access these services. So what do? You have a pandemic now. What happens during the pandemic is people over 70 are being told, don't come to the clinic unless you really have to. We want to see you remotely. Now, having experience, and I'm sure many of us have had experience of trying to get our elderly parents or our older generation parents on Zoom, and sometimes that could take a very long time. It's very hard for them to get on. It's complicated. It's just not a natural thing for them. And, people who are a generation below that are comfortable with it. And our kids, I think, after they have virtually gone completely on Zoom as far as school and even socializing, I think they're going to be very comfortable with Zoom going forward. but, and I'm not advocating Zoom versus another, I'm using Zoom as an example of virtual speaking. So when we look at how difficult it is to call into Zoom to visit virtually with our older relatives, that's the difficulties that exist with telemedicine for older people. They understand the idea of getting a phone call, but if a doctor says, send me a photo of your rash, oftentimes that's something that's just very difficult for them to do, especially through the applications and the complicated systems that exist here. What are the advantages of telemedicine? So obviously, telemedicine is not going to help with every situation. There are some types of medical issues where a medical professional has to lay their hands on the patient. They actually have to, feel that abdomen. They have to be able to measure a joint's swelling, which has to be done by a clinician in person. The average person can't do that. And there are other things as well that you need to have your eyes and ears and hands on somebody in order to properly assess what's going on. So what does it really cover? So it covers an average of 50 to 60% of health complaints can be managed completely on telemedicine. That's an international statistic. What we have found in our practice, and I've been doing telemedicine services for, let's see, with my private company for 5 years, and then before then another 8 years. So a total of 13 years of telemedicine in one way or another. And we have found that we have about an 80 to 84% resolution of medical issues through telemedicine. And I think it also depends on the clinician and what they're comfortable with and what kinds of things that they're being presented with, okay? So one of the things that's happening now, which is very significant, is that telemedicine is reducing people's stress. People, when there's coronavirus going around, and the idea of waiting in a doctor's office, and we've all done this, whether with our children or whether for ourselves, and we waited in a doctor's office and the person sitting next to us is coughing and sneezing, and the kids are playing with, whatever the toys are, and God knows when they were washed. It's a little daunting on a normal day. And now go ahead and put coronavirus in that, and you're looking around, and maybe you have a mask on, and maybe someone has their mask over here, a mask like partially covering their face, but not really. And all you can think of is, I'm gonna get corona just going to the doctor. And that causes a huge amount of stress. I know for myself, when this started really picking up, I got a 3rd-degree burn. I actually did. I got a 3rd-degree burn, and it was small, don't worry. And I treated it myself at home. I did not go to a doctor. I did not go to an urgent care center. At the time, almost everyone who was being diagnosed in Israel had been to a Kupat Cholim, had been to an urgent care center. So I was not going to go there. And I opted to treat this at home. I happen to be a health professional, so that's not so difficult. But rather than going to a specialist, I decided, so I'll have a scar, no one's gonna see it, it's not on my face. But I'm not gonna do it, I'm just not going to take that chance. And I'm not the only person who went through this. A lot of people that would normally have to go to a doctor, whether it's for eye problems that need to be examined or for other issues, sometimes quite serious, they would rather just stay home. And it's just having the option for telemedicine reduces the stress. So that's a very significant issue, especially when you're dealing with children and you can't really manage small children not running around the doctor's office. Very difficult to do. I think that another thing that's very important to note is that there's a significant reduction in duplication of tests that can happen when different people are seeing you and prescribing tests, and you end up getting the same test twice, or maybe you could have gone and got your blood work done one time and it's not as comprehensive. Through telemedicine, it's easier for doctors to actually consult with each other and to speak to each other, and that way the needs that people have are now reduced to a more streamlined system, and it saves healthcare dollars, and it saves, frankly, it saves the patient from getting tests that they may not need or that are repetitive. So that's always a good thing as well. I think that, you know, in terms of how this is being done in Israel, so all of the Kupot Cholim have telemedicine services now. Some are offering phone calls, some have applications where you could see the clinician. For my third degree burn, and I like to use that as an example, I actually was able to contact through telemedicine a nurse burn specialist, and that's actually the correct address for a third degree burn. And this nurse said, you got to come in. You know, I don't know how to do telemedicine. And I actually gave her instructions, and I explained to her, you know, I don't need to come in. I am also a health professional, and I can do this with you. And we found solutions. There were interesting problems that we found because she had not done this before, but we were able to successfully treat and resolve the issue eventually. And so there are ways to do this. Now, so all the people who live in Israel have access to this service. Some of the, and in most cases, you can see your own doctor. So if your doctor speaks English and that's the person who knows you, you can make an appointment. And you could actually speak to your own doctor, and they could put the prescriptions through the system. You still have to go pick them up, but you can put them through the system. So that's a really, really good thing, and it does save a lot of stress, a lot of time. And I do think that that's something that may continue on a longer term basis. The Kupot are reimbursing the doctors at the same rate as if someone was in the office, which is great. Not everything can be resolved this way, of course, but it's a very good solution, and I think Israelis are really getting used to that. Another issue that is problematic in Israel is that there are populations in Israel, such as tourists and students, who don't have Kupat Cholim. There are also other residents in Israel, other visa holders who don't have a regular Kupat Cholim, and those people have limited access to telemedicine. So there are some companies that offer some telemedicine, but they can't handle the kind of volume that is often seen in the time of pandemic. I mean, we were handling, you know, over 100 phone calls a day. During the peak, we were screening people. We were managing, pandemic plans and quarantines, and this person has symptoms, and then they touch this person, and what do we do? And all of these issues were happening all at the same time. We were actually handling over 100 phone calls a day. So you need to have a service that is going to be able to scale up very quickly for the needs of the people who need them. The other thing that you need is the ability for people who are doing telemedicine to get prescriptions to you virtually. So there are solutions for that. We've come up with solutions for that. And that's something that that has to be worked out, and people who have telemedicine services privately need to have that worked out. Another issue is that some of the insurance companies are actually providing telemedicine services with non-native English-speaking doctors. So you got Russian doctors who are answering the phone. You have doctors who don't know you from Adam, who have not taken care of you, and can't necessarily communicate with you well. They also may not have the technology to be able to safely and securely examine you virtually. So I think that there is some room to be improved in these services. Some of the things that we're working on for next year for students who are coming is having virtual clinics and having technology for virtual examinations remotely, such as a stethoscope, being able to look in ears, throats, lungs, and to listen to heart, to even measure blood pressure, pulse, things like that. Those are all very important things, and we're working on getting those technologies for the telemedicine clinics that we're running. I think that that's what's going to happen in the future. I think they're going to be more sophisticated. I think people are going to be able to access more services remotely. I have a company that's been organizing and managing telemedicine for tourists. I mean, people travel to places all around the world and their doctors are back home, and you need to have access to services. So this is definitely going to be a trend in the future. It's a field that has grown like 400 times in the last couple of years. And I think that we're going to see, as this pandemic is starting to teach us, that telemedicine really is here to stay. It is something that people want. It's something that people need. And it's a solution to a lot of the issues that are going on, not just for pandemic, but also for regular routine healthcare. I hope everyone stays safe, stays well. It is May 6th. I didn't say that at the beginning. It is May 6th. And this is Dr. Eliana Aaron. I hope everyone has a good